Okay, and we are live. Hello, everyone. I hope you've had a wonderful day. I had a long day. You can tell I'm looking a little frazzled here. So today we're going to talk about how to put together a home first aid kit, home medical kit, or a mom kit, or hero of the neighborhood kit, whatever you want to call it. So it's things you can easily obtain right now as of 2022. You can still go to the store and buy products, but get it put together soon because, as you know, we wake up every day and the world is constantly changing. So this is what I did. I got this really cute red. This is actually a lunch bag. This is Vans. It's a Vans lunch bag. It's real cute. And I love using lunch bags to create medical kits or first aid kits because they're insulated. So let's open this up. So see, you got the nice insulation. So if you go on a trip or you're taking it to a ball game or in the car, whatever, you throw a couple ice packs in there and then all your over-the-counter medications and supplies are cool. Okay, so besides this, and of course, here's the inside. I pack it with a clear, I guess I'll call it plasticware, Tupperware, whatever. And you can find these plastic containers, grocery stores, drugstores, Target, Walmart, things like that. And so I like these because they're clear, so I can see what's in here and I don't have to search around. And so let's look inside here. Now, again, this is not my medical kit. I'll do that in a separate live chatter video. This is what you can create for your over-the-counter kit. So let's go through it. So now I just got back from a trip not long ago, so I do have to reorganize this. But so, of course, have an ACE wrap. Comes in handy for strains, sprains. You have that. That's easy. And of course, lots of Band-Aids of all sizes. I prefer the big ones because most injuries that need a Band-Aid, they're usually kind of a big scratch or cut. And they stay on better, they last longer. And I like the fabric kind that stretch. So get a variety, again, different size Band-Aids. I have a lot. I usually have them in a little Ziploc baggie in here, but sometimes they're just easy to throw in there. And then, of course, I have a gauze wrap in case the cut's bigger. I'll put a piece of gauze and then I'll wrap it in the gauze wrap. And okay, so I guess we're kind of mixed up to some of the medication. No particular order here, right? Okay, so we have motion sickness. So dizziness, nausea. I mean, you could be on a boat, a roller coaster. You could just wake up with motion sickness from just being in the car or whatever. So this is the brand Bonine. And of course, it's meclizine, and meclizine is the generic name that a lot of these brand names are behind. So really great for nausea, dizziness. You can even take it for vomiting, but I kind of like it more for nausea and dizziness. And then, it's not meant for children. So this is more for teenagers and adults. Okay. Probably good idea if you're over 12 years old. So this one's a good one to have in your little rescue kit to be the hero when someone needs something. And then, of course, I have a leave. You never know when back pain's going to strike. And I sometimes when Advil's not working, Tylenol's not working, naproxen sodium, a leave works pretty well, especially for low back pain. And then, of course, aspirin. And this is the 81 milligram baby aspirin. I relied on this through this big last virus that went around the world. I have a lot of my patients that have recovered from this big virus that went around the world because I don't want them to get a stroke or a heart attack. And certain viruses can really increase inflammation, and cardiac tissue has a strong affinity for certain types of proteins that are associated with this virus. And so I think aspirin is really protective. So I like to carry a baby aspirin, 81 milligram. I'm not telling you what to do with aspirin. Again, check with your own doctor. I myself, just for prevention, I'll take like once or twice a week, I'll do a baby aspirin just for prevention. But Aspirin can also cause thickening of the nasal linings and even sometimes nasal polyps. So if you have a tendency for nasal polyps, you might not want to take aspirin. And of course, if you're on blood thinners, you don't want to just start taking aspirin, like, if you're on Coumadin or Eliquis, things like that. So again, don't just start taking aspirin, check with your doctor. And, but anyway, sometimes I carry this too. Again, if I'm having back pain, which, those of us in healthcare, if anybody in healthcare is watching this, eventually your back is going to bother you. You're in healthcare long enough, whether you're examining patients, picking patients up, turning patients, your back will pay the price someday. Okay, so there's enough on that. Aspirins also can be hard on the stomach, as you probably already know that. Okay, and then here's just, I just carry some Robitussin cough, cold, and flu. So I do like this one. This has guaifenesin and dextromethorphan, and has Tylenol in it too. The really interesting thing about guaifenesin, it has been known to help with the symptoms of certain autoimmune conditions. There's a lot of medical articles on that online. If someone leaves a comment below and wants to know more, I can go more into what guaifenesin does. So I kind of enjoy that. And then there's a nasal decongestant, phenylephrine in here as well. So multi-symptom, it's kind of mini. I like to have that on hand. Of course, eye relief, eye wash. What great for, contact wearers that forgot their solution, or you're in a windy, dusty area. Of course, I like this one. I believe this one does have boric acid. So boric acid is, but before we had all these antibiotic eye drops, we would rely on the pharmacist compounding boric acid otic irrigation solution to help kill the bacteria that could cause conjunctivitis, and usually bacterial conjunctivitis. But boric acid is also antifungal as well. That's why it's kind of nice for contact wearers as well. But anyway, I do, and they do make a nasal irrigation as well. This one's meant for the eyes. So again, eye relief for irritated eyes, or someone has irritation from eye makeup or wakes up with swollen eyes because they use some kind of crazy eye makeup the night before. So it got, of course, our Anbesol for toothache. This stuff has been great in a pinch where you're out of town or you're on a trip or even at home, and you wake up with a toothache and your dentist isn't available. It's the weekend, a holiday. Oh my gosh, is this not a lifesaver, right? And so I believe that is, benzocaine 20%. Okay, well that's a good dose. Clove oil is, if you tend to go really natural, clove oil is really great for dulling the pain for that. And then besides the liquid Anbesol, I also have the gel. This is the Oragel. I have the Oragel tube. Again, easier to pop in your purse if you don't want to carry around the big liquid. And of course, this one has benzocaine, some menthol, zinc chloride, and again, so great. I know when I had my wisdom tooth taken out before, and that was last year, crazy. But before I had that done, it hurt so bad. I swear, I was using the Oragel probably every 2 hours just so I could work and get through the day. And then it turns out it was my wisdom tooth at 53 years old, because that was 53 years old, wisdom tooth coming in, growing in sideways. Anyway, so great to have Oragel. And then Pepto-Bismol. Oh, yes. This one's a generic Pepto-Bismol, but bismuth subsalicylate, right? Boy, is it that great when you have stomach upset, or you ate something that didn't agree with you, or maybe you picked up a little rotavirus or stomach virus. And I tell you what, I love Pepto-Bismol. I think I use it in so many different ways. There's another video I talk about H. pylori. Pepto-Bismol is part of the gold standard therapy for treating that. And of course, that's stomach upset. And then along that line, I have the Alka-Seltzer Plus. So again, this one treats sinus congestion, headache, pain, runny nose, itchy, watery eyes. I got this one on sale somewhere, but I thought, well, it's got Tylenol in it too. And for severe sinus, every now and then I get a sinus infection. And so we have that. Benadryl allergy, you always want to have, especially if you have children. Now they make a liquid one too for kids, but you always want to have Benadryl. You never know when that bee sting or you're traveling with friends or someone has a nut allergy, hopefully a mild one, because otherwise they should have an EpiPen. It's always good to have Benadryl. I give this out all the time. Friends, family, you never know. Of course, have some ibuprofen, low back pain, or just generalized aches, pain, strain. Ibuprofen is better for when you have an inflammatory condition from an injury. Ibuprofen's the way to go. And then, of course, Tylenol would be the recommended over-the-counter medication if it's due to more for illness and particular bone pain. So, for example, my many years of working in hospice, if we had a patient that had cancer that spread to the bone, Tylenol was actually the only pain medicine that would help for the bone pain. So that's a little tip. Tylenol is better for bone pain. And then when you're feeling ill, and Advil ibuprofen is better for muscular conditions like menstrual cramps or low back pain and strain. Stress or tension headaches, it works better. So they do work in both different ways for different things. Tums, I like to keep that in. I don't really suffer from gastric reflux. And again, on another video, I talk about how slippery elm naturals. Okay, so it's no artificial flavors or dyes. This is the extra strength. It's the black cherry and watermelon strength, and it's calcium carbonate, 1,000 milligrams. Another tip, and I don't have it in here because it would be too heavy to carry, is if someone has GERD and there's no Tums available or whatnot, old-fashioned baking soda, the Arm & Hammer baking soda that comes in the little orange container, the directions are still on there for treating heartburn. And I believe it's a teaspoon every 6 to 8 hours mixed with a full glass of water. But again, the directions are on the box. And just old-fashioned baking soda, it still works. Okay, have a little bit more aspirin in there. And then we have our triple antibiotic gel, again, for our little cuts. Here's some more Band-Aids. I like to put a little bit of that on there. And then we have another tube of that Neosporin, because you can never have too much. And then it's good to keep a Dosage Medication Cup for, some of your liquid medications you have. You want to have a medication cup handy. I don't have as much of the children's meds in this kit because my children are older now, but I used to keep, the liquid Benadryl, the liquid Motrin, the liquid Tylenol, and then have my medication cup. So, and then I keep some, cough drops on hand. Why not? And then I'll keep a bunch of cute cotton swabs. They always come in handy. You never know for what. And then it's a good idea. I must have used it and then didn't. So I'll restock the kit. There's just more Band-Aids at the bottom there. I'll restock the kit because I do like to keep a little baggie of safety pins and just, regular hard lozenge candies as well if you run out of cough drops, because that can soothe the throat too, especially if it's just like a lemon drop. Sometimes I'll keep a little container of honey. If it's real, pure, organic, raw honey, because honey has very great antibiotic properties to them. And if you don't have Neosporin on hand, you could actually put honey on a cut or a wound, and it does act as an antibiotic. And then, of course, you cover it with a bandage and whatnot. So, there's articles about that online as well. But again, comment below if you'd like me to do a video on more natural things for first aid. This is just things that you can find at your local drugstore or grocery store. And it's a good idea to start preparing that now because it's getting harder and harder to find certain products, and especially products that are affordable. And so I think that's all I have to say about that. Thank you for watching my video, and please think about helping my channel. Please subscribe and like so my channels can get pushed out there. My video content can get pushed out there and help more people. And thanks for watching.